I would like to start by expressing my thanks and paying tribute to all health and care staff across the UK, not just for the work they always do year in, year out, but especially through the pandemic, where they literally risked their lives to care for us and our loved ones. Sadly, some of them paid the ultimate price, and others who are suffering long COVID are facing losing their pay or losing their jobs. And that's something we should be ashamed of. There's been a massive impact of the COVID pandemic on all 4 health services across the UK, and the 2 biggest challenges are the backlog itself and the workforce that we actually need to deal with the backlog. But there were underlying problems before COVID. The 10 years of Tory austerity, the annual average uplift of NHS funding in its lifetime, up until 2010, was usually between 3.5% and 4%. But for most of the 2010s, it was less than half of that. Scotland spends more than 6% extra per head on health than England. This covers things like free prescriptions, which, in the same way as the Shadow Health Secretary was talking about not charging for GP appointments, also ensures that people take their medication, don't let diseases get out of control, and therefore don't end up costing more in hospital later. But we also spend a massive 43% extra on social care. And that's what allows us to provide free personal care, something that was valued at £86,000 when we heard about the potential care cap in England. Providing free personal care, and in Scotland that includes people younger than 65 if they have the need, allows people to live independent, high-quality lives in their own home for as long as possible. And I'm sure there's not a person in this chamber won't want that when their turn comes. We have the highest number of nurses, care staff, GPs and consultants per head of population of any of the UK nations. But all of the NHSs are facing staff shortages in both NHS and social care. Even where staff numbers appear to have increased, the problem is demand is growing quicker. And that's because we're an ageing population, and sadly, we are not ageing well. From about 50 years old, we start collecting diseases. The NHS gets us through them, it helps us manage them, but many people, particularly in deprived communities, can spend 20 or more years in ill health, and the NHS is struggling to cope with that. That's why we actually need to invest in a well-being approach to every person who lives in the UK, every child born, so they don't end up like a bunch of old crocs like many of us are in this chamber. But safe staffing is vital, because it's not hospitals or machines, but people that deliver treatment and care when we are ill. There's multiple causes for the staffing issues. The decade of austerity meant there were many public sector pay freezes and caps, which made jobs seem unattractive. The caps on public pay and benefits actually takes money out of local economies. Many of us know of dead high streets, so it's also a pointless approach, because there's less tax goes back to the government and it strangles the economy. Actually, giving people enough to live on through decent benefits and paying decent public sector pay injects money into local economies and stimulates growth, which we keep hearing from this government is the big thing that they believe in. Brexit. We lost 90% of EU nurses coming to the UK, a 90% fall, after the vote in 2016, not even with the loss of freedom of movement in 2021. Just the vote was enough to do that. But of course, since the formal loss of freedom of movement, care providers now suddenly have to deal with a Home Office, and many MPs here will know just how difficult that is. They have the cost of visas, they had the administrative burden, and when there's a general shortage of workers because of Brexit, health and social care is having to compete with almost every other sector in the economy. So paying people badly simply just won't wash. There is, of course, the pandemic as well. And I was back in the NHS in the first wave, and I know that in actual fact, staff were incredible in that first wave in 2020. And they felt empowered. We were able to sit around a table, whether physical or virtual, work out what needs to be done, make a decision, move on, in a way that staff on the front line are rarely empowered. The problem is that now this has gone on for 3 years. Staff are suffering from exhaustion and burnout, but instead of people clapping for them, they get negative media complaining about staff, complaining about GPs, suggesting GP practices are shut, that a phone appointment doesn't count. I became quite ill and ended up in the hospital across the road in autumn 21. When I finally got back to where I live, I had 3 GP consultations, 2 specialist consultations, and just 1 day in a hospital going through tests before my medication was organised. Frankly, with my lifestyle, that suited me down to the ground. I didn't need to hang around in a clinic, risking being infected by COVID. The job got done. So let's stop denigrating phone appointments. GPs are not stupid. They speak to the patient on the phone and they need to examine them. They'll arrange that. We also have to realise our duty in that. It's not just the media, it's also politicians. And I really have to gently point out to the Shadow Health Secretary, particularly as my own husband was a GP, GPs are not just gatekeepers of the NHS. They provide long-term continuity of care, they examine the patient, they are advocates, and they guide the patient to the right service. Imagine you have back pain. Were you digging the garden? Do you need to see a physio? Has your disc slipped? Do you have a kidney stone? Do you have a leaking aneurysm? Or do you have metastatic cancer? How is a patient meant to disentangle that without a GP? I will.
To be clear about this, I've never disputed the important role that GPs play in terms of their expertise and the important role they play, particularly in terms of diagnosis. But I just say to the honourable member, if she thinks GPs are so fantastic, why are there so many fewer now under the SNP in Scotland?
Well, that isn't true, and 99% of our trainee posts are already filled from last year. I think you should maybe look at the stats. We have a higher number of GPs per head of population than any of the other nations of the UK, including Wales, which his party runs. So what is it that we need to do about this? Well, OK, number one is train more staff. That's clear. But you need to increase both nursing and medical student places. But not just increase the places, actually look at the cost of studying and the student debt that they will get left with. We don't have tuition fees in Scotland, and our nurses get a £10,000 a year nursing bursary. That means we're investing £20,000 in every student nurse in Scotland.
She talks a lot about the inputs that the SNP government have made in Scotland. She talks very little about the outcomes in Scotland. Would she agree with me that actually this carping about the fact that things are like this rosy land that she portrays in Scotland, not true, as we're hearing from the SNP leadership election, and how bad it is in Wales and in England and in Northern Ireland? We need now to start learning from the very different ways in which the different governments are providing services and working with people across the piece. So I think we need to stop carping about these differences. We need to learn from each other. We need to recognise that outcomes are different and stop just talking about the inputs. Was that something she would perhaps like to work with other people on?
I think I've spent the last 8 years showing the different approaches that Scotland takes. The Minister talked about community pharmacies, which have been providing minor ailment care in Scotland since 2005. Our optometrists are allowed to refer directly to hospital for people who have cataracts. That's something they're often made to go through a GP here. So I am sharing and have shared, but there is an increase. There's a 5.8% increase in uptake in nursing staff in Scotland. So we also have more nurses per head of population. And I would like to maybe make some progress. The honourable gentleman had a very long time at the dispatch box, and I think it should be more than just the 3 of us. It's important to recognise the impact of losing the nursing bursary in 2016. Nursing student applications fell in England after the nursing bursary was cut. So maybe this is an idea I am sharing, is just that importance. They recovered to some extent in 2019 when it was brought back, but it's only £5,000 and tuition fees are over £9,000 a year. So nurses in England are graduating with debt of about £50,000. They need to immediately begin paying that back, which is therefore coming out of their salary. So that's something that maybe could be looked at. If you increase medical students, it's not just that you need to ensure there are places on the ward for them to learn, as was raised by the honourable gentleman on the Conservative benches who's no longer in his place, but you also need to make sure you expand and fund the training places in hospital for after they graduate. There was a real problem last year with extra medical students graduating who couldn't find foundation jobs until the last minute. And if they don't go through the foundation scheme, they simply can't practice as doctors. Also need to invest in the middle grade, the specialist training, to create consultants, because that's what you actually require. We do need to recruit more from overseas, because going from student to consultant, depending on what it is, or student to GP, is 9 or 10 years. Student to consultant surgeon would basically be about 15 or 16. So adding more student places won't solve this in the short term. We must, however, avoid recruiting from low and middle income countries that are on the WHO red list. That is simply unethical and is being reported as direct recruitment from trusts in England. And that's something that should simply be, we should be ruling that out. That should not be allowed. And I think the government could actually tackle that. We have, unfortunately, lost freedom of movement, and it's clear from Labour that will not return. That's a challenge for us in Scotland because we need people. We have a huge demographic challenge. But the government needs to put health and social care roles, all health and social care roles, on the shortage occupation list. Reduce visa costs and hassle. 49% of overseas GP trainees in the UK report visa issues. 17% of them say they may leave. So the whole obstruction of dealing with the Home Office is literally driving doctors away. And maybe waive the NHS charge for staff who work in health and social care. But most importantly, and I would agree with all the members on this side of the House, is to retain staff. Otherwise, we will lose experience. The first start would be some decent pay. And after the pay rises and COVID, they absolutely deserve it. The government is keen to wave about the independent pay review body when it suits it, but somehow to ignore it when it doesn't. Nurses in Scotland were already being paid between £1,300 and £2,500 more than nurses in the rest of the UK. And to catch up with Agenda for Change staff in Scotland, the UK government will need to give a 14% pay rise for the coming year. And if they did give a decent pay rise to these incredible staff that work in the NHS, then devolved nations would also be able to fund a decent pay rise for their staff. Both Scotland and Wales are limited as they have no real borrowing powers. We also need a review of the pay, terms and conditions and support for junior doctors, how their rotas are managed, what their quality of life is, because we need to understand why they're leaving the UK. Some of it is they want the adventure and experience of working overseas. So maybe we should actually look at building that into our training schemes, giving them a flexible year to either do research, work as a volunteer, or work in another country. And of course, we need reform of the mess of the NHS pension. The lifetime and annual tax allowance system is penalising senior staff if they do extra work. Many are refusing extra roles, such as clinical director or educational supervisor. They're turning down overtime, which is critical to clearing the backlog, going part-time or even retiring earlier. Scottish Government, and I'm sure the Welsh Government, are offering pension recycling and retire and return. But that is all the devolved governments can do. The problem lies in the Treasury, And it is nonsense when this was introduced in 2015 as supposedly dealing with tax evasion, tax avoidance, to bring it in on a public sector defined benefit scheme. You can't play with your pension in that way. And the problem is, rises in pension pot are being counted as income. Staff have no way to predict that, and they end up being faced with huge bills simply for being able to work some extra weekends. We also do need to maintain the wellbeing projects that were started during the pandemic. All NHS staff are still facing huge stress this winter. This is made worse by the staff shortages, the increased demand from COVID, influenza and other respiratory infections. And if you look at the COVID data from 2022, you will see there was no respite. Unlike 2020 and 2021, hospital admissions still stayed relatively high, even between the peaks. And that means the staff have literally been running non-stop for almost a year and a half. As was said, staff are willing to work hard. They've always worked hard. But the problem is when they go home at night feeling they didn't do a good job, when they feel their ward isn't safe, then that's something that undermines both their commitment and ability to do the job. And the General Medical Council report that burnout and dissatisfaction are the two main reasons driving senior staff out of the NHS. But we mustn't forget social care staff. I was surprised it wasn't mentioned in the Labour motion. The standard measure of NHS performance in all 4 health services is the 4-hour A&E target, because it assesses the flow through a hospital from admission to discharge. This actually started to deteriorate in England in 2013 after the changes of the Health and Social Care Act, but it fell in all 4 health services in the later phases of the pandemic as hospitals were trying to restart elective work. NHS Scotland is also struggling after COVID, but despite the snide comments of both Tory and Labour MPs, I would just gently point out it's still the best performing of the 4 nations. And struggling A&E performance is not driven by A&E issues, but the back pressure of patients who are waiting for a bed, and that is delayed discharges. Lack of care home places or staff to deliver home care is what's driving the A&E issue, and you therefore need to take it as a thermometer to test the temperature of the entire acute system. There's currently over 160,000 vacancies for social care in the UK. You can't fix the NHS without fixing social care. So you need a workforce plan for both NHS and social care. And as in Scotland, you need to respect care staff. Pay them a minimum of the real living wage, not the pretendy living wage. Pay sleepovers when they carry them out, and pay travel time. Because to have them doing all of these things unpaid is undermining their take-home pay. In Scotland, care staff are now registered and getting access to professional training and development. This is part of our plan for a national care system. But care staff need decent pay. They also need recognition and respect for a very tough job looking after our loved ones. I can't imagine anyone in this chamber who could do the job. They need a career path so that good staff who enjoy delivering care can remain in the care sector and not just use it as a stopgap until they can get a better paid job on the till in a supermarket. Thank you.